Hello Health Tips channel followers. Today we will talk about constipation in children, its causes, symptoms, and the ways to get rid of it, so let's fly together. Constipation in children. Constipation, also known as difficulty defecation, is one of the problems that may affect children, and it is not considered a disease in itself, but rather a symptom that usually occurs for a short period of time, and is often not serious and is not due to a problem's serious health, and constipation is represented by a small number of stools so that it is less than twice a week, and the child may feel that the abdomen is not completely emptying the waste, as well as facing difficulty in excreting or feeling pain during that, and the stool may be hard, dry and unusually lumpy. It is worth noting that the precise definition of constipation must be linked to the knowledge of the child's normal excretion. In fact, the nature of excretion varies from one child to another. What is normal for some may be abnormal for others. In addition, the nature of excretion and the duration of its recurrence varies with the age of the child, and this fully applies to infants. A baby's output changes a lot, especially during the first weeks and months of life. Causes of constipation in children. Constipation usually occurs as a result of the slow movement of waste through the digestive system, so the stool becomes hard and dry, and the factors that play a role in this are the following. Output retention. Children may put off going to the toilet in order to play, or because they are afraid to go to the toilet, or because they are outside the house and do not want to use the toilet outside. It is worth noting that if the child is constipated, the stool may be somewhat difficult due to the dryness of the stool, and this may push the child to hold the stool more and more. He tries to avoid feeling pain when going to the toilet. Changes in diet. The lack of adequate amounts of fiber sources in the diet, such as vegetables, fruits, and water, may cause constipation. Constipation is most noticeable in children if solid foods are introduced into the child's diet. Change in the child's routine, such as situations of extreme heat, stress, or travel. Such factors may affect the movement of the digestive system, and it is indicated that a child going to school for the first time may cause constipation as well. Cow's milk allergy. Cow's milk allergy may cause constipation, and excessive intake of dairy products may cause constipation. Having a family history of constipation. The chance of constipation increases if a family member suffers from this problem. It is believed that these individuals share environmental or genetic factors. Having certain diseases. The cause of constipation may be the child's infection with a certain disease, but this is extremely rare, yet the doctor deliberately excludes these problems when the child suffers from constipation, and examples of these diseases are problems and defects of the spine, hypothyroidism, and some metabolic disorders, problems with nerve endings in some parts of the colon. Symptoms of constipation in children. The symptoms that appear in children who suffer from constipation are the following: abdominal pain, excreting less than 3 times per week, and as for the infant, he may be constipated if he does not pass it for 2 or 3 days. The child's reluctance to go to the toilet and try to hold the waste. This may be known from the features of the child's face and the placement of the legs on top of each other. The appearance of streaks of droppings on the underwear on the child's clothes. Bloating more than usual. Fecal incontinence. This condition is represented by the child excreting waste on his underwear without feeling, as he does not realize that there is a need to go to the toilet, due to the accumulation of stool in his rectum for a long time, and it is worth knowing that fecal incontinence is one of the complications that may result from chronic constipation. A fissure in the anus or anal fissure is defined as a small fissure in the anus that causes pain and may have slight bleeding, and it results from tightening during the process of excretion. Tips to get rid of constipation in children. Most cases of constipation in children are treated with lifestyle changes at home, as follows. Changing the diet, including adherence to a specific meal schedule, helps treat constipation in children, and the following are recommended points to follow for this. Stick to a balanced diet in addition to snacks. Avoid fast food, which is usually high in fat. Reduce consumption of caffeinated beverages such as tea and soda. Reduce consumption of whole milk, by consulting your healthcare provider. Serving breakfast early to the child. This is in order to give the child's body enough time to have a bowel movement, i.e. excreting, before going to school, as the bowel movement is usually within 30 to 60 minutes after finishing eating. Drink plenty of water and fluids, to help facilitate the movement of stool into the intestines. The amount of water and fluids to be drunk varies depending on the weight and age of the child, but 3 to 4 cups of water per day are suitable for most school-age children. Introducing more fiber to the child's diet, by trying to adhere to the following: eat more fruits and vegetables. Add whole wheat cereal and bread to the child's diet. Pay attention to food labels on food packages, in order to pick out those that have a higher fiber content. Avoid foods and drinks that do not contain fiber or even those that contain a small percentage of it, such as ice cream, cheese, potato chips, ready meals, and processed foods. Exercise. People who do not move a lot are usually constipated, and therefore helping the child to do more exercise is useful in cases of constipation, because of its impact on the digestion process, as exercise helps facilitate the natural movements of the intestines represented by pushing food during its digestion, and this by encouraging the child to play outside, or to engage in various activities indoors instead of watching TV. Follow healthy bowel habits. It is important to try to get the child into the habit of going to the bathroom regularly. The child should be encouraged to do this several times a day, especially 20 to 30 minutes after breakfast and dinner, as this helps to take advantage of the normal bowel contractions that occur after eating. It should be noted here that the child is encouraged to sit on the toilet even if the child does not feel the need to defecate. While the child is sitting, it is important to maintain a certain position that helps the child use the muscles necessary for expulsion, by placing his feet on a small chair so that the knees are higher than the level of the hips, and attention should be paid to making the child lean forward a little while maintaining the straightness of the back, and the child may need to support his elbows on his thighs. Attention should also be paid to making the child lean forward a little while maintaining the straightness of the back. It is advised to maintain this position of the child for a period ranging from 3 to 5 minutes without distractions such as books, screens, etc., and to help this, the child can be rewarded when he sits on the toilet even if he does not defecate, and it is important here to use a reward appropriate for the child's age and to avoid punishing the child if he does not defecate, and it is necessary to motivate the child to enter directly to the bathroom when he feels the need to defecate. Thank you for watching the video. Please subscribe to the channel, press the like and bell buttons to receive each new video.